So, morning, Boone.
Good morning, Mel.
So, one of the things that we often ask our patients to do is measure their blood pressure at home, maybe because their blood pressure is too low or because it's too high. But we don't really talk about how we do that. So, is it possible to talk us through? But first of all, tell me, why might we ask our syncope patients to measure their blood pressure every day at home? What's the benefit?
So I think the blood pressure measurement is a very, very important gateway or window into your cardiovascular or autonomic health. And one of the things that we always get confused about is what an individual blood pressure measurement means and how reliable that particular blood pressure is. Now, when you go into your GP or when you go to your practice and you have a blood pressure taken at your practice nurse or GP, it is often the case that they do more than one recording, and there's very good reason for that. The blood pressure is very, very fluctuating on a day-to-day, minute-to-minute basis, and even second-to-second basis. And this is something we see all the time when we do what's called non-invasive or invasive continuous blood pressure. And so to try and encapsulate all those variable readings into a single reading means you have a single reading from a single cuff. Typically, the cuff of a blood pressure looks like this. It is a wraparound cuff, and it's something that you could kind of open up with a strip of Velcro, and you wrap around your upper arm. That means where your biceps are. And this should be a cuff that is very fitting. And I'll just share a screen now to first guide you to show you what blood pressure cuffs are validated. Typically, I tell my patients to get something that they can purchase from either online or in a good health shop. And the blood pressure monitors that you see here on this website called Stride BP are all validated by all the hypertension societies. And all I would ask is that you always get one that is upper arm cuff, because those are the most valid blood pressure readings. And several brands stand out. A&D is a good brand, but so is Omron. So if you're ever needing to check whether your blood pressure cuff is reliable or validated, then these are the blood pressure cuffs, including the automated cuffs you can get for something like 30 to 40 pounds, okay? So that's the first thing to say. Stride BP, blood pressure valid monitors, which are upper arm cuff, importantly with a cuff size that fits appropriately. I'm going to stop sharing now. The next thing to say is that when you measure your blood pressure, always take 3, if not 4 readings and discard the first. And before you sit and have your blood pressure taken, make sure that you're in a position where you haven't just come away from exercise or a large meal, because all these factors influence your blood pressure. So ideally sit down on a chair, arms resting by your side or on a table with the cuff already prepared on your upper arm, but don't press the button yet. So sit down, slow your breathing for 30 seconds, and then press the button to get your blood pressure reading, write it down, and then continue to do a slow breathing exercise and press the button 2 more times. So all in all, your blood pressure should be taken at least 3 times. Ignore the first, take an average of the next 2. And that is how you can get a much better idea of your blood pressure without the fluctuations that can be seen in day-to-day practice. The first reading is often discarded because that is a reading that's likely to be inappropriately high or artifactually high, because you've just gone to the trouble of putting the cuff on, you've just got yourself in position, and sometimes that gives you an artificially high reading. So it's very important to know what your true resting blood pressure is, because that's the value that we think persists throughout the day for you in a normal day.
Is there any particular time of day that you should do it? And in order to get a good pattern, how many times a day would you recommend that someone measures their blood pressure?
That's a great question, Mel. The first thing to say is that the blood pressure measurements really depend on what your condition is. And if your condition is hypertension and you are quite hypertensive, that means your blood pressure is high, and you are starting on medications, I would advise you take it once, if not twice a day, first thing in the morning and then 12 hours later. And when I say first thing in the morning, it's when you wake up, come downstairs to the kitchen table, or even by your bedside, do this maneuver that I've just suggested with you sitting squarely on a chair or a bed, and the blood pressure cuff done or fitted on your upper arm whilst you're at rest. Similarly, 12 hours later. Now, if your blood pressure is in a normal range and you know it to be normal, then you may not need to do another blood pressure for another 12 months, especially if you're fit and healthy otherwise. It's only when something is changing and you want to get to the, for example, ideal drug dose, or to see whether or not you need another drug to treat hypertension, that you may then need to do your blood pressure multiple times, for example, in that week prior to seeing your GP or your cardiologist, to then up titrate the next dose or to add in the next tablet.
Some people measure their blood pressure at home and it's normal, so say 120/80, and then when they go into their GP surgery, it's 160/90, or when they go to work, if they find work very stressful, it's high. Which one is more reliable, and is that relevant?
That's a great question, Mel, and the answer is comes back to something I feel very strongly about, which is you have a great influence on your blood pressure, not only physically doing things, but in the way you think, in the way you react to the external environment around you. So the so-called traditional white coat hypertension, what you were just describing, when you go into a GP practice or see a clinician who's typically traditionally wearing a white coat, is a very common phenomenon. And most of the time in the past, people have dismissed this as a one-off phenomena. But actually, if the white coat situation, i.e. stress, is with you for the 24-hour period, in that you work in a stressful job, the mortgage bills are a struggle, you're having difficulties with relationships, these white coat conditions, so-called, are going to be affecting you more proportionally in the day if you've got the external environment that influences you. So the answer, Mel, is both. If you are the kind of person who genuinely only gets a bit anxious and nervous at your GP practice, but you come home and you're completely chilled out, then the likely reality there is that your blood pressure is normal when you're truly normal at home. But if you have a blood pressure, or if you have a characteristic that you're always on edge and always stressed out, and you're in a high pressure work or home environment that constantly gets you stressed, then it's very likely that the GP white coat and your home hypertensive readings are both true. And then when you get a low blood pressure reading, that's also true. But what is predominant in the 24-hour period is your period of stress, and therefore you are likely to be hypertensive. So I know it's a long-winded answer to the question, but you really need to reflect as a patient on what life and how you're feeling about your day-to-day challenges. And it may be that that white coat hypertension is not so much something that's transient, but it's more dominant in your day-to-day life.
And if that is the case, so you find that you are stressed for all of the reasons of modern living, what's the best way to get your blood pressure down? Is it medicines? Is it dealing? Obviously, it's easy to say deal with the stress, but what's the ways that we can try and do that?
Yeah, I think there's an element of a trait that we develop over time, and this, in my humble opinion, is something that develops even very young as a child, because we kind of reflect upon our parents' traits and how they handle stress, and we grow up in that environment where we also handle stress in a particular way that we've learned by observation. So that is a very challenging question, Mel. But in terms of principles of change, or principles of, first of all, physiological understanding of how stress impacts blood pressure, I strongly feel that there are two components of your brain, which is the primitive brain, which is also known as the autonomic nervous system. And that autonomic nervous system controls those bits of our bodily functions that we don't normally have to consciously think about. So this is subconscious autonomic brain. I call it the primitive brain. And let's say that exists on one level. And this is the thing that influences our blood pressure in this particular question. Now, what regulates the primitive brain is actually a higher brain. And so we have two components. The primitive brain is the thing that allows us to react quickly, for example, to a saber-toothed cat pouncing. But there's a higher consciousness or a higher brain, or the cortical brain, which actually exerts and regulates the primitive brain. And the interaction of these two brains is what I term, or what has been termed, emotional self-regulation. And I think to try and regulate that primitive brain through a higher consciousness, or to be mindful of how we are reacting to the external world, is one phenomenal way to gain control of these rising feelings of anxiety or tension in responding to the external world. Let me put it a different way. There are things that are beyond our control. Sometimes our job, our career, how bad our boss is. And there are things that are within our control, which are thoughts and actions. Essentially, what I'm saying is that sometimes we have to release control of the things that we have no influence on. You cannot control how your boss will react to you, but you can control how you will react to your boss. And you can take the action that allows you to put yourself in the best position so that the reaction will be positive. And this self-control, regulating your thoughts and your actions, is what I think we should always focus on. And this is called, I think, emotional self-regulation, where you let go of the things beyond your control, which is the thing that people find difficult to do, and you focus on what's within your control. So that it is entirely within our control to respond to an external stimulus in a positive way, even though the external stimulus is toxic, and to think in a different way. And this opens up a whole new kind of discussion that, you know, we might pick up on a separate topic if we come away from blood pressure. But it's a question that's very close to my heart.
It's a great question, and we'll cover it in another session, because the question is, how do we emotionally self-regulate? But we can come back to that. Just one other question is, some people, so is high blood pressure, does it cause symptoms? Can you tell if you have high blood pressure?
Answer is typically no. You can often tell if you have low blood pressure because you might be dizzy, lightheaded, feel faint. But in a high blood pressure situation, the often giveaway for very high blood pressure is a pounding headache. But apart from that, there's very little to happen until potentially a catastrophic event, which is directly contributed by high blood pressure. That's something like a stroke or a heart attack, but that's too late. So I would urge everyone to at least know what your blood pressure is, even if it's when you visit your GP for your yearly check. If you're above 40, you should get that done, and have your blood pressure taken in the way that we describe, which is three measurements, and ignoring the first one, taking an average of the other two. And then if it's high, and when I say high, the values I'm talking about for high blood pressure is more than 135/85, typically at home or when you're relaxed, and strangely more than 140/90 when you're in a clinical environment. And the reason that's the case is we recognize as blood pressure physicians that there is going to be a white coat effect. And so we have stringent lower values when you're taking your blood pressure at home. And there's nothing wrong about doing that, so long as you get one of the validated upper arm blood pressure machines that I've shown you on stridebp.org/blood pressure-monitors.
That's great. Thank you that you've really clarified things. So, so the first thing to do is to get a validated blood pressure machine on stridebp.org. The next thing to do is measure it, and you can discuss with your doctor how often you're going to do that, but that involves finding a relaxing period at home, resting on a chair or in a bed, measuring it 3 times, discarding the first measurement, taking average of the second 2, monitoring it, perhaps keeping a diary. And the key take-home message that you've just said is that you don't have to have any symptoms. So this is something that you need to be proactive in doing. because it might be that it's too late. It can cause heart attacks and strokes. Thank you very much, Boone.
Thank you, Mel.